India's vaccination drive seems to be struggling, even though the country produces its own jabs. Several states have implemented a curfew to contain the spread of the virus. Now, India has reported an average of 90,000 cases daily over the past week. Former senior associate editor at the Tribune India, Prasad Kunduri, joins me now from New Delhi. A very good morning to you, Prasad, and thank you so much for your time this morning. So, is this supposed vaccine shortage a case of India not producing fast enough, or that the second wave is just so intense that it's hard to keep up with?
Good morning to everybody at eNCA and the viewers. What's happening, of course, is a mix of both. I would say there are enough vaccines, is what we hear from the government. The Union Health Minister, Dr. Harshvardhan, a medical doctor himself, has maintained that there is no shortage of vaccine in terms of its stocks. Some 23 million already in stocks and 19 million in the pipeline. So some 43 million doses are available, is what he has just mentioned, and close to some 93 million as we speak. A little while ago, I checked the government dashboard, which gives you an updated figure as we talk. Some 93 million people have been vaccinated. Is that the figure show? Of them, some 11 million are the second dose recipients. Of course, the surge in the drive is also because the government is making extra effort to try and encourage people to vaccinate themselves. And in fact, in the last 3 months, there have been opening of the way in which vaccinations will be delivered to people. The eligibility criteria has been altered to now anybody over the age of 45. From April 1, that has been the new norm. So we are seeing a sudden rush of people trying to get them vaccinated. Of course, as we speak, there have been reports from various states, and some states in particular have reported that the private hospitals are not able to cater to the demand.
Prasad, at what rate do jabs need to be administered to ensure that India's program keeps this pandemic under control? Because we do, of course, all know that India is dealing with about 1.3 billion people. So it needs to be happening at a faster rate than, I suppose, every other country in the world.
Well, I think right at the beginning of January this year, before the vaccination program was rolled out, the government had made some kind of estimate that it needs to inoculate some 300 million people by the summer.
Prasad, I just want to make sure, are you still there with us? Okay, looks like we have lost Prasad Kunduri, of course, the former editor.
Yeah.
Prasad, are you there with us now?
Yeah, thank you. I'm sorry.
Okay, fantastic.
As I was saying, what happened is before the government rolled out the vaccination program January this year, 16th of January in particular, when it began for the frontline workers, over the 3 months, they have relaxed the way people who could receive. Now it is anybody over the age of 45 can receive this vaccination. There is a portal in which you register yourself, or there are walk-ins in many hospitals. So the numbers have increased in the last few days. Added to it is the concern of the spread, the second wave. So people are more aware of it. And as we speak, as of yesterday, that is on Thursday, the Prime Minister of India had a meeting with chief ministers of all the states to review, and said that between April 11th and 14th, there should be some kind of a vaccination festival. The whole idea is to encourage more people to get themselves vaccinated. 300 million was a target by the summer, 400 million could be by September. Far away from the herd immunity that the immunologists and the epidemic people, experts talk of. But yes, that's the ambitious drive.
All right, Prasad, thank you very much. Unfortunately, that's all the time that we have, but we do appreciate your time here on All Angles. That's Prasad Kunduri, who is the former editor of the Tribune India, coming to us from New Delhi. Right, we're going to be going back.